We are back, Sport and Spinal Weekly. We're talking with Jason Brodena, Choice Therapy, Dr. Lyle Erickson, Chiropractic Sport and Spinal Rehab, and a discussion today of how Choice Therapy and Chiropractic Sport and Spinal Rehab work together to get people better. Now, I know that, when I was in high school, and it seemed like the alternative to cutting your knee up and having surgery was therapy. Is that still part of the case today?
I think we do a lot of therapy for people prior to surgery to see if we can rehab them without them having to, quote unquote, go under the knife. So we do see a lot of that, and that's a large part of our rehabilitation and our patient caseload. Once again, I kind of bring it back to what we're talking about. If somebody comes in with knee pain, it's very important to look at the whole body, and we try and take a whole body approach at Choice Therapy. And that may mean some spinal adjustments to the lower part of the spine or the sacrum, the tailbone, to fix that knee. So just because you come in with knee pain doesn't necessarily mean you won't need some chiropractic care, or an ankle adjustment for the knee to help line that foot up properly so you don't have problems that if you line up your ankle properly, that's going to help your knee pain.
Do some potential patients, do they see a therapy and chiropractic as not having to have surgery? Is that still an option that people think? Because I don't know, in the past it seemed like it was like, oh, don't have surgery unless you don't have to, and now with technology it seems like people are having more surgery, but it doesn't always mean that's a safe thing, right?
Well, I think, again, it depends on where patients are getting their opinion, from. Certainly there's, and we both our professions work fairly tightly with medical doctors, in that some medical doctors are more conservative than others with surgery. And, I think the trend is that if you can prevent surgery, that's the key. You do hear a lot more about surgery, again, because you say, there's more non-invasive approaches, arthroscopic surgery on the knee, boom, it's done, you're out, in and out. But again, I think if you can prevent that with realigning I'll give you a good example that Jason probably sees in his practice every day. If you can realign the way the kneecap or the patella tracks, that may prevent some surgery 10 years down the road. And so, simple little things that most people don't think about from a standpoint of rehab and preventative, I think, we're fairly trained in.
And not that I'm knocking on doctors, because you guys are doctors, but because you guys see more like, let's say, a sports injury, and you see how something is stretched or torn, not saying that a regular family doctor doesn't, but you guys, since you see it more, you probably know the condition of that and how the person could make changes.
Well, for instance, for us, we get a lot of referrals from surgeons for patients prior to surgery.
Okay.
They'll have them come in and say, okay, try therapy for 3-4 weeks. If you don't recover, then we'll look at doing surgery. But let's try the conservative approach prior to surgery, because if you don't need to have surgery, let's not do it. And that's most of the surgeons, that's their approach.
And then I guess what I'm looking for is when they suggest therapy, because therapy should pretty much work a lot of the times. I'm sure it doesn't work for everybody, but is it usually the person they don't make that commitment to their therapy to do it? Because I know when I tore all the ligaments in this left knee, I did half my therapy, and now this knee tear, I could throw it out throwing a football across, and I've done it more than once, but it was not my lack of commitment to the therapy program to make my knee better. So that I was just thinking about me. I hope I'm not the only one.
Once again, it comes down to, from a therapy standpoint, when we do things, we are showing patients how to rehab. We're giving them the tools to rehab. They have to take it on themselves and recover on their own. We will help them with it, but it's a lot of home program and things like that. There are many times where we see people, if they come in and their knee is torn up, we may see them 1 or 2 sessions and we say, we can't help you, this knee is shot. You need to have surgery. And so it's usually pretty often that we can tell within 1 to 2 weeks if they're going to need surgery or not.
Is that common or less common? Is that more rare when you okay, there is no hope for your knee? Or is there, I guess what I'm asking is there is more hope for rehabilitation than people believe sometimes?
I think there's some people want to, like you had just said earlier, take the easy route and end up getting your knee, so to speak, cut, and having surgery. However, 75 to 90% of the time, you're probably going to have rehab after that surgery anyway. So if you can rehab it without having surgery, you're going to be a lot better off.
So, for example, the gentleman that was going to go downhill skiing, say, had his knee not been making the right fluid motion, regardless of what you could do, first you got to get him to Dr. Erickson to make sure that's right?
Yeah, you'd want to make sure that everything's in proper alignment. You want to make sure that with Dr. Erickson and Sport and Spinal, they do a lot with the spine, and the spine plays a larger role for your knees, your ankles, your shoulders, your elbows than people realize. So you need to take care of that alignment before you can work on a lot of the other things on your body.
Kind of like diagnosing a car. First, we'll make sure that this is even working properly before we'll start diagnosing why you have a flat tire.
Yeah, exactly. And you'd hit on a good point there with patients and surgery, and a lot of people want a quick fix on things, and surgery has been touted as the quick fix, and Jason, I'm sure you've seen it, and nothing against surgeons because they do a phenomenal job. They do just an excellent job. But their surgeries fail. Back surgeries, for example, I mean, they fail. There's plenty of studies. They fail 50% of the time, 70% of the time. Many studies show that
it's your back,
and it's your back, and it's important. You can't get a new one.
Yeah,
like you can get a new knee or a new shoulder or artificial, but so I bring that up because it's really important, and because I think between chiropractic care, let's talk about low back pain, low back injuries. Doing some chiropractic care and then doing some physical therapy along with that, the strengthening portion of it, is going to prevent so many people from having surgery. It just would. It's
like the seatbelt thing. If we just took a little better care of our core and our lower back, we'd probably have a whole lot less problems. And you'll probably tell me the same thing, my doctor, if you would just exercise a little more, Mark. Get off the couch, stretch.
Well, people are pretty pretty passive. They don't like to do things. I don't know, Jason. What's the stat I know I've heard in our practice is that if we don't show exercise with people, I think only 30% of people will actually follow through with things on their own. It's a pretty low percentage.
Yeah, for us, we want to show the people the correct way to do their exercises, and then not overload them with exercises, but getting into the mode of working out and exercising is the best preventative thing that you can do for your body to prevent injuries. And Dr. Erickson will attest to that. I mean, you need to get your body in shape.
And it goes right along with good nutrition, good diet. It's a whole the whole gamut of healthcare is and if you want to talk about preventative care, that it's the diet, the nutrition, the sleep, the exercise, everything together plays a huge role.
So I guess my last question would be, and I know that cases are different, but a person, let's say they needed to have a speedy recovery by having a team like you guys working on that related situation, could give them the opportunity. I know you can't guarantee it, but the more people and focus you have on a situation, could get better quicker.
Absolutely, and particularly if people are open to that approach, which most people are in the experience of my practice. And I am totally open to patients, approaching me with, hey, doc, you mind if I try some physical therapy? I'm like, absolutely, you should try some. In fact, let me make a call, and I'll set you up with someone that we can work with together. I know they do a great job, and we can coordinate care, and I think their recovery times will increase phenomenally.
And I would assume that a lot of people want to get rid of their pain as quick as they can.
Yes, most people want to get rid of their pain as quick as they can. And that's where that comprehensive plan of care with as many medical professionals as possible is so important. That's where, some people want to take that quick fix of a pill, but it's always going to come back. But if you can get to see a physical therapist, a chiropractor, and maybe a dietitian, and we'll make a comprehensive plan of care to take care of your problems so you don't have to keep popping those pills.
Well, we certainly did share a lot of information today. Jason, Choice Therapy, thanks for coming in.
Thank you.
Dr. Erickson,
Hey, you bet. There was no fights even today at the table. You notice that?
I know, you guys are getting along. There was no disagreement on technique. It worked out pretty good. We all can live happily ever after, can't we? That'll wrap up our talk for today's program. When we return, we'll talk about next week's show, our weekly tip, Sport and Spinal Weekly. More when we return.
Questions for the doctors? Email your question to ssweekly@paulbunyan.net. This is Sport and Spinal Weekly on 92.1 The River.
Have you ever been told you just have to live with the pain? Far too many people today are living needlessly with pain and taking drugs to hide their pain. Every day, many people just like you are learning chiropractic care can be an effective alternative to drugs and surgery while restoring pain-free living.
For quality chiropractic care, call Chiropractic Sport and Spinal Rehab of Bemidji at 444-2117. Whether caused by an auto accident, work injury, or other circumstance, receive expert treatment from Sport and Spinal Rehab. Sport and Spinal Rehab will accept most insurance, so give them a call. That number again is 444-2117, or find them on the web at www.sportandspinalrehab.com.
Chiropractic Sport and Spinal Rehab. Renew your whole body, your whole family, your whole life.
For more information, visit Chiropractic Sport and Spinal Rehab online at www.sportandspinalrehab.com.
Don't miss Happy Honda Days or the Big Finish 2011 from Honda of Bemidji and Bemidji Chrysler. You'll choose from the area's largest selection of pre-owned vehicles with over 200 pre-owned imports and domestics. Quality pre-owned cars, trucks, vans, and SUVs from the area's only new and used vehicle superstore, Honda of Bemidji and Bemidji Chrysler. Has your vehicle been making noise? Get your vehicle repair done by the best. Bemidji's Best Auto Service. Bemidji's Best Auto Service is a full-service auto maintenance and repair shop. From headlights to taillights, tires to the top, and everything in between. Bemidji's Best offers honest and always a fair price. It's what they believe in and how they do business. When your vehicle needs a little help, visit Bemidji's Best Auto Service. Just a block north of the Eagles Club on Washington Avenue in Bemidji. Bemidji's Best Auto Service.
Have you had the misfortune of experiencing an injury recently? Chiropractic Sport and Spinal Rehab of Bemidji is equipped with a comprehensive treatment and rehab program for auto, work, and sports-related injuries.
Chiropractic Sport and Spinal Rehab also offers a complete wellness program for all your health needs. They're committed to helping you achieve and maintain your good health. Call Chiropractic Sport and Spinal Rehab at 444-2117 and visit them online at www.sportandspinalrehab.com. That website again is www.sportandspinalrehab.com.
Sport and Spinal Rehab treats the whole family in a comfortable, friendly atmosphere. Sport and Spinal accepts most insurance, so give us a call. Again, that's 444-2117. Chiropractic Sport and Spinal Rehab. Renew your whole body, your whole family, your whole life.
Get fit now at the Gillette Fitness Center, located on the BSU campus in Bemidji. Go for a swim, run a few laps, take a yoga class, or just work out. It's all here for you. The Gillette Fitness Center offers state-of-the-art equipment and facilities to help you slim down, tone up, de-stress, or just plain play. With flexible membership options to help you achieve your fitness goals. Open 7 days a week. Visit the Gillette Fitness Center, located on the BSU campus in Bemidji. This is Sport and Spinal Weekly on 92.1 The River.
Have you had the misfortune of experiencing an injury recently? Chiropractic Sport and Spinal Rehab of Bemidji is equipped with a comprehensive treatment and rehab program for auto, work, and sports-related injuries.
Chiropractic Sport and Spinal Rehab also offers a complete wellness program for all your health needs. They're committed to helping you achieve and maintain your good health. Call Chiropractic Sport and Spinal Rehab at 444-2117 and visit them online at www.sportandspinalrehab.com. That website again is www.sportandspinalrehab.com.
Sport and Spinal Rehab treats the whole family in a comfortable, friendly atmosphere. Sport and Spinal accepts most insurance, so give us a call. Again, that's 444-2117. Chiropractic Sport and Spinal Rehab. Renew your whole body, your whole family, your whole life.
You're listening to Sport and Spinal Weekly on 92.1 The River.